Hi, everyone. So yes, we had a nice introduction, but thanks for the opportunity for speaking here. We're just here talking about an approach to redesigning health data management, and I'll kind of go behind the story of how we all came together. There's 5 of us, and actually the rest of our team members are in the audience. And
go ahead and stand up.
There. And we're a mix of students from the School of Public Health, the School of Information, and the School of Law School. And we kind of came across a situation, and I'll talk a little bit more about it, but I'll start it off with how we got together and kind of going through what our approach was and what we presented to everyone. So we met at this U of M Multidisciplinary Design Jam. This is some pictures of that evening. And how it was is that it was a 4-hour workshop on a Friday evening. And they opened it up to multiple schools, but it was, I guess, created by the Innovation and Action Group in the School of Public Health. And we all came in, we were pre-assigned to groups, and they wanted to have multiple disciplines in each group, which was important for the collaborative process. And we were presented with this problem with designing a tool or policy that accounts for different informed consent policies, electronic consent management capabilities, and patient preferences for data sharing among multiple users. Which is a mouthful, and I think most of us Friday evening had no idea what that was talking about. And most of us in our group had no idea what this was all about. I put the date there specifically showing that we were only introduced to this topic about a month ago. And before that, we had no knowledge of learning health systems or consent or anything in healthcare systems. So this, I'm just kind of setting your expectations on what we might be presenting, but might be a little bit of an overlap with what everyone else has talked about. But we're excited to talk about our idea, and we'll get started.
Right, yeah. Thank you. So, just like what Harita has said, it's going to be echoed a lot with what's already covered. So just some overview about the current situation within the field of informed consent. So we emphasize on 2 things. First, there are numerous challenges within the field of informed consent. And second, our health data is extremely fragmented. And informing is hard, yeah, of course. And first, why? Health providers just don't do it well. Doctors are not trained to inform patients. Whenever I go visit a doctor, they never tell me what's in the consent form. You just need to sign the consent form or not. So patients are left unaware of the meaning or the results of signing those consent forms. And just like what was brought up earlier, we don't read the terms ever. So there's actually one study that's showing people actually agree to give out their force forms as one of the clauses because we just don't read. Yeah, and
they got Wi-Fi.
Yeah, and of course it's understandable because there are just too many options there for consent. There's opt-in, opt-out, opt-in with restrictions, opt-out with restrictions. So they're just confusing. And there's this idea about resignation. So it turns out the more educated you are, the more likely you will just give out your information because you know your data is already being used by, everybody. So in terms of why it's not moving? It's not working. Okay. Yeah, so in terms of the data, it is just shattered around. So now, because first, each health agency is using the information individually and within their own health system. So hospitals, clinicians, individual doctors, insurance companies, they all use different parts of the information in different format. So because of that, there's really poor health information sharing because the laws and regulations between different states and incompatible systems of different health systems. Because different softwares, different databases, and different format of the file that you're using. So a lot of times, hospitals are using fax to just sharing information. And finally, as individual users, like around the house, we just have those piles of like random papers of your hospital visit. And so what now? Oh, just like this. So what now? So we propose that we really want one single point of access to your health data and to a way to get education about your consent form. And more importantly, we want more control about our own data. And I think this kind of ties back to the trust issue of like, because we have more control, now we may be able to like trust our health providers a little bit more. And this is the framework that we are proposing. We call this IMI, the Insurance Medical Information, where as an individual patient, you sign up your insurance. When you sign up for your insurance, you are also giving out your consent. So what we're talking about here is that we are shifting the responsibility of educating patients about the consent forms to insurance companies. So basically, this is how it works. You use your phone or use your Wi-Fi to sign up with your insurance company, and then you get this little tutorials over there. It can be video, and it can be the things that just be introduced over there during the last presentation. And then you will be notified about what you're going to sign up for, and then you will get this insurance card, which would work as a key to a cloud storage of all your electronic health record. And this key is going to be encrypted with a chip, maybe, ideally. And then whenever you go to a hospital and visit the hospital, you will show this key to your health providers, to your doctors, and your doctors will be able to access your electronic health records in that storage. And also, they can upload the information, upload the visit, the records into that storage as well. So at that way, our individual users will be the main player here to manage our own data, and it will be able to give a say, saying, oh, this is the information I want to give you, and to what extent. So, yep.
So I guess I didn't add it in the beginning, but we were actually the winning team that evening, and that's why we're here. We had the opportunity to talk about our pitch. Thank you. But I think what our feedback that evening, one of the reasons why we were chosen out of I think there were about 6 or 7 teams, was because we incorporated insurance into the discussion. Whether or not it's a feasible option, that's a different point because it's only been a month. We're still doing research, but we felt that insurance was something as a good place to start with because they have an established infrastructure already. They're already connecting with patients and they're already connecting to healthcare providers. We don't have to really start a new infrastructure, and they're already storing healthcare data. I talked to my primary care physician, and he's talking about how he has to upload all of the patient records electronically, get sent to the insurance company, and then they do some analysis and then they send it back. So this type of exchange of healthcare data is already happening in some way. I did say majority of Americans are insured. That could be it's either a high number or a low number. I haven't gotten the exact number, but to at least start it off, to check out to see how insurance companies can be part of this consent process, I feel like there's enough people to work with because most of the people have some type of insurance or some type of payer plan that they can work with to see how consent can be given to the insurance companies to deal with. As per our research for the past 3 weeks, we've been looking at a lot of working systems around the world just to see what are other countries doing. And we kept coming back to European countries because they do seem to do healthcare a little bit differently than the US. And we did notice like the Netherlands has a nonprofit that oversees they like opt-in and opt-out type of thing in the system, and patients have the ability to access their own information and be able to change consent and everything. In the UK, it is said in a lot of literature that physicians ask them consistently every single time they enter a office, like what is your consent, your permission for today or tomorrow, and patients can then go to kiosks and healthcare clinics and constantly update consent and permission of their healthcare data. Not saying that anything is right or wrong, but a lot of countries are already trying. I mean, it seems like everyone in the world is trying to figure out how to deal with this problem, and those are different ideas that we were kind of looking at. Like, okay, so countries are doing something like this. It's not impossible. I also wanted to include the VA in the U.S. because the VA seems to be a really prime example of how a well-connected system works in the U.S. because they seem to do some things very differently than what the normal healthcare infrastructure does in the U.S. And I feel like we can learn a lot from them on basis of how they manage healthcare data, especially with people being able to travel state to state but still be able to have control over their healthcare data, even if they change physicians. Going forward, I think our biggest thing is to network and understand the problem much more in a deeper level. I guess it was a great opportunity for us to be here with everyone and listen to all the talks since morning to just really learn about what is going on in the field because like I think previous speakers have mentioned, we don't do this full time. We're in class most of the time, and this is a completely brand new subject for us. And we do realize there are challenges. There is a lot of mistrust with insurance companies, and a lot of people, maybe that's why they've not been included in this discussion, but we hope to open that dialogue to see maybe they are another entity that would like to be involved in this discussion, especially maybe they want to improve their image of mistrust in the society. But they're also trying hard to connect with patients because of, creating better websites for patients to access their information. They're getting into apps. They are trying to deal better with patients. So maybe giving them that responsibility of consent kind of goes along with their 10-year plan maybe because they could probably incorporate it in their structure. But for now, I think we want to focus on healthcare exchange just because of the amount of data, and you go to a doctor's office and how consent has not really been talked about. I go to my primary care physician and I'm not really too sure about how is consent communicated to me. So I think we want to focus on that, but after hearing everyone's talks today, I do realize that consent is much more broader, especially in research and genomic studies, and we want to just open and see how we can incorporate all types of consent and all different situations in the future. And we are planning to go forward with this Innovation in Action competition, part of the School of Public Health, with this idea. And so that's why we are in the process of interviewing and trying to talk to insurance companies, healthcare providers, patients, just to better see what the problem is and understand the problem. So we would really also appreciate feedback from everyone in the audience today too, and just to get a better understanding of our idea and how that idea would work in the broad scale of things. Thank you.